From APTA's CSM 2018, I'm Jason Bellamy, and I'm joined by Heather Smith, and we're going to talk about quality. We're going to talk actually specifically about quality care, and APTA recently put out a podcast series, a different podcast series than we've done in the past. A bunch of episodes, all very small, very specific, defined by topics, so you can sort of go through that. But we're talking about quality and values. Value is the word I should have used, and value-based care. The idea of providing value in healthcare is not new, right? That's the whole point. So if we're evolving toward value-based care, and we are, in that context, how do we define value? What does value mean?
Yeah, that's a great question. So there's two key components to value in healthcare. The first is outcomes, the outcomes that are achieved by the patient. And the second is cost. And really what we're looking at here is what are the outcomes achieved for the dollars spent. And that's simply what value means in healthcare.
So it's not just getting better, it's getting better specifically in a way. And so if we're evolving toward value-based care, that means obviously we were in this position where we didn't have that data necessarily or weren't looking at it quite that specifically, and now we're being asked to. Where are we then in this evolution? Are we at the start? Are we midway through? Does it vary from person to person? Where are we in that?
Yeah, I think PTs have lots of different experiences in this space right now, and probably many of our therapists may be starting to feel the push to value-based payment. However, I think there's a lot of therapists out there that are still very much in a fee-for-service model. And so some examples where we're starting to see this move is obviously Medicare, and Medicare has the joint replacement episodic model, and that's a value-based model that looks at the course of care for patients who undergo total joint replacements. Many therapists will start to see these models emerge, not just from Medicare though. We're starting to hear about more and more interest on the private pay side as well, because quite frankly the commercial payers are a little bit more nimble than Medicare, and they have a lot of interest in moving in this direction. They want to get the best outcomes possible while controlling the spend.
So how fast does this evolution have to happen, if that makes sense? I mean, in other words, how differently will value-based care be in 5 years from now, for example? Radically different, kind of the same? I mean, I know that's hard to answer, but how fast is this train moving?
I think it's going to move a lot faster than we think it will. I don't know if we know where we're going to be in 5 years, but I do think that we're going to see these models emerge quickly and rapidly, and we need to be prepared to participate in these models and talk about the value that we bring as physical therapists in the healthcare system.
And so I asked that question to get to this one. Right now, you know, when you talk about data and the need to track outcomes and things like that, I could imagine a PT who's not a clinic owner or not an administrator thinking, well, that's above my head. I don't have control over that, so I'm just going to keep doing what I do. Who needs to understand this evolution? Is it important truly to everybody, or is it just sort of for an administrator or a practice owner?
It is important for everybody, and depending on your role, you may look at that differently. So an administrator may be thinking about how to position a clinic, where a clinician may be thinking about how do they affect those best outcomes in practice. How do they work with colleagues both in the clinic and beyond the clinic, physicians and other healthcare professionals to deliver the best care. But everybody needs to know what's going on in this space and stay informed as it's continuing to evolve.
And also not assume that the owner or the administrator doesn't need your support, right? So you can always communicate up the chain. Along those lines, again, I mentioned the podcast series. It's available through iTunes. It's available at apta.org/podcasts, where we have links to all of our podcast pages. What are, say, 2 or 3 things that anybody could do to sort of feel like, okay, in the least I've done these things to try and keep up with this train that's moving?
So I would say there's 3 main takeaways. The first one is get educated and stay up to date, and some of the ways that you can do that is to listen to the podcast series. If you're here on site, please come tomorrow morning, actually, at 11. We're going to be doing a lecture, Emerging Issues in Medicare, around value and value-based models and quality, so that's another resource. We just launched a new value-based care website. webpage on the APTA website, and we have a host of references there and resources, including the link to the podcasts. So that's the first one, get educated, know what's going on. The second is collect data. So if you are in a clinic right now and you're not collecting data, hopefully that's not the case, collect data, look at your outcomes, understand the value that you're bringing to your patients. And the third is, as we move into these models, just collecting the data isn't going to be enough. You're going to need to utilize some type of data system. And that may be inherent in your practice already, and so maybe you're working in a health system and you have a way to get your data aggregated so you're able to look at specific patient populations that might be included in these models. You can look at the data around your total joint replacement patients, for example. If you don't have a data system, one option is the Physical Therapy Outcomes Registry, and that's part of the reason why we have the registry, is to really help us advance the profession and help therapists be prepared for this evolution of value-based payment.
So those are the things you can do, and again, the podcast series is a great place to start. You can jump in and out of episodes, that's the idea. Pick the ones that you think are applicable to you and then go back and forth. We're going to be doing broadcasts like this from CSM today and tomorrow. She's Heather Smith, I'm Jason Bellamy, and I'll catch you later.